NUAA is a peer-based drug user organisation funded primarily by the New South Wales Ministry of Health. We advocate for the health, human rights and dignity of people who use or have used illicit drugs, including those either on or seeking treatment. If we want to provide really excellent health care for people who use drugs, we need to tackle stigma and discrimination. People experience stigma when they feel a sense of rejection based on a personal characteristic, in this case, drug use. Stigma is the attitude and discrimination is the behavior, but discrimination can take many forms. Research shows us that stigma and discrimination lead to poor health outcomes. People avoiding care, dropping out of treatment, and only seeking treatment when very unwell. These videos are people who use drugs talking about positive and negative experiences of healthcare.
Several times, especially when I can't be honest about my previous history.
Yes, I have.
In particular, decisions are being made without you having any control over those.
Not being able to be truthful with doctors in some ways because of being having a fear of being punished for certain behaviours or having those behaviours focused on.
You could see they were not engaged. They were just, well, let's get this bloke out of here as quickly as possible. Write him a script for whatever, and hopefully he accepts it and send him on his way.
I got arrested and I ended up going to jail. When I got out, I was actually asking for sleeping pills because my sleeping pattern was bad. And actually, I just wanted to get something to help me and calm me down, and at the same time not make me drowsy so I can go and exercise. And they actually refused to give me that medication. Yeah, not once, 10 times.
The pathologist and the doctor asked me straight up, and that's when I stopped seeing him, was, oh, they can't take your blood because you're a drug user.
The stigma was I didn't want my family to find out, but the doctor had to call my mum and let her know. So that was a letdown, because what about privacy between doctor and a patient?
You're on a OTP program, which I was, and I felt that every time I disclosed that information to a hospital, I was instantly treated different. I was waiting a lot longer than everybody else.
If you present to an emergency department or to a public hospital, your file clearly distinguishes you as a drug and alcohol patient. So there is a clear change in the conversation and the tone in the room when you get to a point where they look into your record.
They put you in a waiting room, like you got issues. You're sitting on a chair, there's a big, well, no, when last time I had a chest pain, I was sick. I actually had that influenza about 5-6 days ago. When I went to get amoxicillin, they put me in a corridor in a chair, and the doctor came, he goes, don't come to my office, sit here. And he came down and he checked everything, he was wearing masks, gloves, and he goes, wait here, I'm going to write your prescription and then you can leave. I feel really bad. You've got your office, you've got chairs, you got your computer in front of you for a reason, so you should help people, not to put him like he's got the worst case scenario issue that you can't deal with.
We often don't realise some of the things that we might be doing that do come off as, or do create a power imbalance with our patients. So whilst we might think, well, the only experience they're having with us is whether or not they get this script or that script, and therein lies the power, there's a whole lot of other things like the waiting in the waiting room, like the treatment that the front desk have of these patients, and the way that they address these problems, big red flags on their patient file that they can see because it sits right in front of them and it says, opioid dependence or whatever, on there in like big red letters when everything else is in blue and green. There's all these different ways that I think, apart from what happens in the consultation, contribute to that sense of power imbalance.
It's very frustrating, and once it's happened once, you can foresee it. So in that kind of situation, you're either going into it with this enormous amount of anxiety, or you're going into it almost ready for the battle.
It does make me feel disengaged with the particular doctor, or occasionally I've just kind of been known to flip the table and give up on trying to like pursue a certain diagnosis or certain healthcare altogether, because it just seems like too much work, and then kind of makes me ignore problems and then they pop up again.
I'm second guessing. Should I go in there? Should I be honest? Should I lie? Should I invent something? You know, just, it's a horrible space to be. It's a really horrible space to be.
It made me go and seek somebody else, and also put off my treatment for a good few months, which in my head I knew was vital from the experience I was going through.
Because I felt like maybe I shouldn't have told them I'm Aboriginal, maybe I shouldn't have told them I'm on an OTP program, and that turns me off going to a hospital, doctor.
The whole time it's like I'm listening and feeling for that judgment or that remark of derision or whatever. And as soon as that comes, it's like, boom, I shut down.
As doctors, we need to be really mindful of the fact that we have something that people really, really want, and we have access to things that people really, really want, and therefore we're in a position of power. And I think what we don't realise is what they're really, really seeking is a doctor that's got a listening ear, a doctor that's going to look at them as a whole person.
How much have you been drinking? I told him, and he said, yeah, last lockdowns I was drinking a bottle of wine a day. They are nightmarish. Like, make sure you just don't keep doing this because it is bad for you, but get through it how you need to. And it was just one of those experiences of someone going like, yes, you understand the function of drugs in society and to people. I'm doing this for a reason, and that's because like my existence currently is, not currently, but like at the time was just stressful and miserable. So having someone go like, oh yeah, cope how you need to, but stop when you can, was just so comforting. Like I just, like the tension dropped from my chest. It was, yeah, just a little bit of human vulnerability from his end was great.
She didn't want to know why I used drugs in the first place. She asked about my general health, give me a rigorous going over. I think when I found that GP that I've been talking about, that was a real aha moment for me. I thought, I found someone who cares. Hang on to this person for as long as possible. If she moves to a different surgery, follow her.
She actually took time to call me to come back again and tell me, these are the plans that I'm going to put you on. This is going to help you, which was seeing a mental health nurse, to talk to a mental health nurse and talk to a psychologist, and at the same time put me on a plan to see a counsellor. I was talking to mental health nurses, I was seeing a counsellor, and it was helping, but then I ended up going to jail.
This doctor was amazing. What I really appreciated about her was her pragmatism, you know. So I inject in the neck, and that's the only spot really that works well. And she allowed me, pardon me, to do the butterfly and get my own, put the butterfly in and take blood. She let me participate in my own, I guess, treatment. And she will forever stand in my mind as a rare case of a truly awesome doctor. It was wonderful. It was absolutely, it was just wonderful.
The one place I can go where I do feel comfortable is the AMS, Aboriginal Medical Services. They actually educate you and tell you, well, what you're doing is harming this part of your body and this and this and this. So it's a bit more, yeah, they sort of tried to educate you a little bit more. But they're not, I don't think they're really judgmental.
Other times when I've talked about mental health, and this recent practice especially, which is the only practice to which I've disclosed my drug use because they've been generally good, she was the first one to not look at my mental health and drug use in a vacuum, but rather look at it as related to my physical health, and that was Yeah, it was very refreshing. She let me drive the conversation. She kind of let me pick which topics were most important to me, and then kind of went, yeah, that one actually sounds like a problem. This one, due to time, we'll leave for later, make an appointment for next week.
What's most comforting to hear about with all those consumer experiences is that they weren't looking for GPs with special skills in the drug and alcohol medical field. They were looking for what is just normal, everyday, good general practice, which is someone that's going to listen in a non-judgmental, open, honest manner and have a sort of shared, collaborative approach to someone's healthcare and being open-minded. And that is not necessarily a drug and alcohol specialist. That's just doing good general practice. In terms of, just the way you start a consultation, I think there's sort of this growing divide between two types of GPs at the moment, and just changing the conversation from when they sit down in the room and you're pressed for time and you go, what's the matter with you today, or what have you come in for today? Instead, just changing that to what matters to you today, or what is important to you today. It's just a lovely way of changing the beginning of that conversation, and it can flow on from there, knowing that we're here and we're concerned not just for our agenda but for the patient's agenda as well. So I think that's a very quick and easy way to change a consultation style, and just off the bat, with that first impression, change the way the patient perceives you as a doctor.
Sitting down and having your doctor listen is really important up front, and just being able to understand what you're saying and just take it at face value.
Like, just don't judge would be my advice.
I think the main thing would be for the staff to try to make that person feel comfortable and remember that they're a human being.
An open and equal communication style, so there's not the absence of the implied superiority on whatever level of clinician versus patient. Any patient, not just drug-using patients, but any patient. Human to human is very important.
When you get a lot of judgment from outside people and then you speak to this person who's a health professional that understands you at a base level, it's like really relieving, because it does take a lot of judgment away from yourself, because there is a professional out there that sees you for more than what you're experiencing, essentially, and like sees you as just a person, and will have an honest conversation with you and talk to you like a real person.
Actually listen to the problems that we're bringing to the table. Don't I feel like a lot of doctors search for almost a mental Rolodex of the easy solution, and it kind of ignores the complexity of who we are as people.
The way you smile, the way you say good morning, the way you say hello to someone can change someone's life. First impression is last impression. That's all I can say.
Really high value thing we have in our consult room is not the prescription pad, but actually that listening ear. When you actually ask them, things like, hey, has anyone spoken to you about your cardiovascular risk? What about your cancer risk? Are you up to date with your bowel cancer screening? Or, when you're trying to take that standard general practice preventative care approach and show that you really care about their health and well-being long term, it's like their jaw drops and they're like, oh, I thought you only saw me as, as a drug and alcohol user. I didn't realise that, you actually were going to go into that for me. No one's looked at that kind of preventative care. There's a lot of things in the systems around us that could also make a big difference. Things like our receptionists, and maybe getting them on board a bit and saying, look, this patient, when they come, that they may need a bit of extra time. Maybe just a little bit of extra consideration about, the way your waiting room looks and, what kind of signs you might have up, and the way your reception team handle a patient, and the way you respond to those little requests of permission in a consultation.
This video focuses on power imbalances. Power imbalances are a feature of healthcare and are magnified when people are highly dependent on healthcare. like when they're on the opioid treatment program or seeking maternity care. Some of the features of power imbalances are inaccessible language, not attending to or dismissing information provided by the patient, decision-making based on personal views rather than on the information that the patient is providing, and public disclosure of personal information. People who use drugs are very aware of power imbalances and how these play out. The negative experience described by the people in this video have a common theme: a lack of care by clinicians and a lack of regard for the patient as a human being deserving of respect. The positive experiences involve people feeling a sense of choice and ownership around their health, resulting in better health outcomes and an increase of self-esteem and agency.